Hi, good afternoon, everyone. Thank you for joining us on this coffee hour. We have today's speakers. Nick Los Baños is the Alzheimer's Association of Hawaii Island Regional Coordinator. He worked with the Office of Aging, specifically with their Aging and Disability Resource Center team. Prior to joining the association in October 2020, Nick worked with Hawaii Care Choices Hospice and palliative care provider in Honolulu and Hilo. He volunteers as a member of the Community Action Network and Advanced Health Care Planning Committee of Community First, a nonprofit organization geared toward improving health on the Hawaii Island. He recently joined Community First team as consultant to the Path of Palliative Care Project, a community-based initiative to enhance access to palliative care in East Hawaii. Nick's professional experience is supplemented by his personal caregiving experience with his grandfather, who lived with Alzheimer's in his final years, and his 97-year-old grandmother, who is living with dementia. Nick is currently working on his dissertation as a candidate in Concordia University, Wisconsin's Doctor of Education program. Welcome, Nick. The second speaker is Caroline Kadirao, and she is the appointed director of the State of Hawaii Executive Office of Aging on Aging since June 2019, with nearly 20 years of program management experience. With the Executive Office of Aging, she now leads the agency in charge of coordinating a statewide system of elder care and caregiver support services in Hawaii. Caroline brings to the position nearly 30 years of experience in the field of aging, advocacy, and programming. Most recently, Caroline served as a program specialist in the Executive Office on Aging. And in that role, she was responsible for the oversight of several programs, including the statewide expansion of the Aging and Disability Resource Center, the Healthy Aging Partnership, and the implementation of the Kupuna Caregivers Program. Without further ado, let me present to you our speakers for today, Nick Los Baños and Caroline Kadirao. Thank you.
Aloha. Thanks so much, Gilbert. I appreciate the welcome, and good afternoon, everybody. So today we'll be talking specifically about 10 warning signs of Alzheimer's. And the reason why, I think this is a really important piece of just healthcare in general and our personal lives is that, research shows that people don't get diagnosed till really, really late, right? And one of the things that doesn't help you with is you can't really take advantage of any of the resources or programs, or they're not as effective, if you catch this later on. So one of the bigger goals of the association is actually really to make brain health sort of like just like how we treat our heart health and our blood. I mean, we can measure blood sugar, we can measure our blood pressure. Brain is a little bit different, right? I mean, and so, we're going to cover 10 warning signs because I think the first thing that anybody can do, whether you are no matter how old you are or how young you are, I should say, or, if you're working with folks who are in the upper age bracket, I'll leave that to your interpretation, what that means. But in general, if you start seeing some of these signs, one of the things we encourage folks to do is figure out how to reach out to some resource like us, or a doctor or somebody. And so we're going to walk through the 10 most common warning signs of Alzheimer's disease, as well as kind of go through a little bit of some steps that you could take to help somebody or yourself if you are noticing one or more of these signs. Okay, so that's what we're going to talk about. I'll have some time at the end to do question and answers. We can also talk about the resources that we provide. So really, again, we're going to frame these warning signs in terms of what might be more of an age-related typical type of change versus something that might be Alzheimer's disease or dementia. And like I said, we'll go through those common warning signs. We'll touch a little bit on what happens when you do have these concerns and do start looking at diagnosis and those types of tests. And we also have a couple of handouts. I'm not sure if you got them yet, but I will get them to you if you didn't, on some tools that you can use if you are just trying to help somebody or yourself walk through this process, okay? Feel free to throw your questions in the chat if you'd like, and I'll try to watch that as well. So the first thing that we are gonna do is really look at, So I should also mention, I'm going to be skipping some slides because this is actually an hour presentation, but I'm pulling out some of the salient points. So let's look at the 10 warning signs. First, we're going to talk a little bit about what dementia and Alzheimer's is. I think that's one of the biggest most popular questions we get. What's the difference? Why do we have to know? Does it matter? So let's hear a little bit from some of our professionals in the association about what the difference is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor to find out what you're dealing with.
As you heard there, a little bit of a human anatomy review there for some of us, but I think one of the things that helps people understand this disease, whether you have it yourself or you're a family member hearing this about your loved one, is really recognizing that there is something happening, right? Like I said earlier, you can measure your glucose level in your blood and say, oh my gosh, diabetes, right? You know, not too long ago, not too long ago, Alzheimer's, the only way you could tell was if you cut open the person's brain and looked at the shrinkage, right? Of course, nowadays, with technology, with all of these screening abilities we have, we can definitely do that without cutting somebody's head open. And the problem with that, of course, is they weren't able to do that until the person had passed, and by then, so what, right? So, of course, we'll cover some of those tests later, but there are ways now that you can pinpoint specifically Alzheimer's without cutting your brain open. I do want to mention that you often will hear these terms interchanged. And I think the reason for that is because Alzheimer's disease, when you saw that picture of the umbrella, right, that dementia is like that umbrella term. I like to think of food because, I don't know, that sticks better with me. So when I think of the word soup, right, the word dementia is like the word soup, and Alzheimer's might be like miso soup. And then you have those other types, which might be like chicken noodle soup or whatnot. Because miso soup's the best, no, I'm just kidding. So you think about, dementia and the types under that umbrella. Alzheimer's makes up about 80% or so of diagnoses within the dementia umbrella. So that's why I think you often hear them interchange, because it is the most prevalent one of the types. Okay. One thing I do want to mention, though, with, as testing and diagnosing becomes, a lot more advanced, we are actually seeing people who have multiple types at one time. So you're starting to see what they call mixed dementia, where you might have Alzheimer's disease with vascular dementia. The reasons for knowing these things are there are specific treatments for different ones, or there can be. So, people often ask me, why does it matter? Well, it depends, right? It depends on how you want to I think a lot of what happens is you're making choices about how you want this to go. So let's jump into the 10 warning signs, and then we will talk a little bit about how that diagnostic and testing process goes. So we've created a map here of 10 most common warning signs, and we'll go through each of these really quickly. The first one, I think this is one that's pretty standard. I think people understand this one about Alzheimer's disease, is that memory. Challenges with memory. That's probably one of the most common signs, right? If you've ever had a loved one with Alzheimer's, you understand what I mean. But if not, basically forgetting things that you might usually would have known. Okay. You also start to see somebody with memory loss, maybe relying more on memory tools. Like for me, I'm a Post-it person. See, look, I have all these things all over the place, right? That's just my way of going through things. But if that wasn't my norm, and I start to do that more often, that might be a sign that I'm having some challenges. One of the things I want to say, when you look at warning signs, they're all relative to somebody's normal, right? If I never used Post-its in my entire life, but now I have them posted all over, maybe there's a change in my abilities, right? And that could be a sign. One thing people tell me, I've actually had people call me, and this is not a bad question. There's never a bad question with us. They would say something like, I forget where I put my keys all the time. And I'm like, okay. But the question here is, can you find them after? If the answer is yes, then you probably don't have any kind of memory situation. The one of the key things that distinguishes something like a Alzheimer's related memory problem versus age related or normal aging would be the fact that you can retrace your steps and find those keys. Okay. If you have problems going back to find those keys or find that Post-it, then that's where you start to kind of think about, okay, is this something other than just me getting older? Second one there is challenges in planning or solving problems. So, I think a more typical age-related change might be, again, something that you just weren't really good at in the first place. I know people who cannot do a to-do list because that's not how their brains work, right? They just kind of fly off the cuff and hope they finish all 5 things. Well, again, if that's your norm, then that probably wouldn't be an issue if you are experiencing it in your, again, older years, and you can define that however you'd like. But really looking at executive functioning, meaning, if somebody puts together a plan for the day even, here's the things I'm going to do, and you can't follow through with them for some reason, that's what we're talking about here. Again, if that's not your way of functioning normally, then of course that's a little bit different. But if I was to say, here are the things I'm going to do, I miss them all, or even if I can't make that list of things to do, that's one of the signs as well. Number 3 is difficulty with familiar task. Keyword there being familiar. What you see with some people is they might have been doing, crochet for all their life, and now they're starting to miss the loops. Okay, or maybe their pattern is off, or the thing doesn't stay together. For us, actually, I will share my grandmother, who I think in the intro, she's 97. She still does those little scrubbers. I don't know if you use those little crochet. Is it crochet? Yes, scrubbers, right? That was actually one of the things we noticed. She started missing the last one, and it would fall apart. And so we would always have to kind of support her with that last step. But that was one of the things we saw. So just again, the key there is familiar tasks. If you are not good at crocheting at all, then of course that probably wouldn't be a sign for you. But even just things like forgetting appointments, if that wasn't your thing in the first place, no problem. But if it's a new behavior or a new challenge, that's where you would kind of think about, is this something I got to look at? Number 4, confusion with time or place. One of the things that clinicians will use a lot of times when they are trying to establish whether or not somebody has a cognitive challenge is asking them, what time is it? What day is it? What season is it? What year it is? Where are you? And so forth, or even who you are, right? I think one way to look at this is people with Alzheimer's will often have a challenge with passage of time. They don't know what time of day it is, what season it is. I've worked with people where they show up for their appointment. They can talk about everything in their life. They know their address, they know their phone number, social security number, but they didn't know what day it was, what year it was, or even what season it was, what time of day it was. So it's very interesting. You never know I think one of the things with Alzheimer's is you're never going to know what part of the brain is really going to be affected at any given time, right? So it's a little tricky for people. But time or place definitely is one that you see. Number 5, visual and spatial images. So a lot of times people will go to the eye doctor and say, but her vision is fine, but she keeps tripping over stuff. Okay, well, there's a difference between having like a cataract, issue versus your brain not able to process images, if that makes sense, right? So she's physically able to see the step, but her brain can't establish that it's up or down. So there's a little bit of a difference there. Another thing for that would be the stop sign, the stoplights, right? Which one is which? Even though red is stop, somebody with Alzheimer's, their brain might not be able to make that connection that means stop. Although they know it, their actions might not respond and they might gun through. I know this because when I used to drive my grandma around, she'd be like, go! I'm like, no, it just turned red. And I don't know if she was joking, but that was her thing. I don't know if she just liked to do that to irritate me while we're driving, but yeah, so challenges with spatial relationships. You also start to see this in terms of hallucinations almost, right? Where people, families tell me all the time, my dad's talking to somebody in the corner and I don't think, and spiritual stuff, I go for it, I know a lot of people, that's whatever, but in general, the point is they're seeing something that isn't there, right, to us. And so that is also one that can be something that people kind of experience in their family members. Number 6, words, problem with words. Speaking, writing, a lot of times they start, especially early on, you'll notice people with Alzheimer's to be a little bit withdrawn from conversation because their brain is a little bit challenged when it comes to hearing what the person is saying, translating it, and figuring out what to say back. So, one of the tips we tell caregivers is keep your sentences very, very short and don't ask a lot of questions because their brain has to take extra time to process what's being said or even read. So that's another one. Again, if you are not a great speaker in the first place, and you're stumbling over your words now versus then, same, not a worry. But, one of the stories we have from one of our participants, he was a writer all his life, and now he struggles with just typing something out because his brain can't connect the words fast enough to make a coherent sentence. He has to go back to the beginning and wonder, what did I mean here, right? So if that is another sign, just challenges with verbal, written, and reading. Number 7, misplacing things. Again, kind of similar to memory, you can't retrace your steps. That's the key there, right? If you can go back and find it, you're probably okay. But in general, if you can't figure out that, okay, I walked in the house, I put my keys on the table, I went to go get a soda, I went to go do this, okay, let me walk backwards. If you can't do that retracing piece, that's where the concern is really, that's kind of where you're looking at a concern. Number 8, decreased or poor judgment. Unfortunately, you see this one, and I'm not sure if, from the legal field, you see this often where maybe they said to their kid, yeah, take my house, take my money, whatever, and granted, a lot of times that's a cultural or personal choice, but then they go ahead and blast their parents' money and now they're going to lose their house or whatever, right? Cultural things aside, I think that you start to see things like that, or unfortunately, one that we see often is somebody will show up at their house, say, hey, looks like you need some branches cut down to, from your roof. I'll do it for $100. If you pay me today, I'll come tomorrow. Now, again, if you go back to that first box there, right, they're already having trouble with memory, so they might not even know, or likely won't know, that they gave that $100. So whether or not the guy comes tomorrow, oops, right? So you start to see things like that, or even just in general where, healthcare choices. If you've been really good with your doctor's visits all your life, and now it's like, no need go, that's another way you can look at that. 9, withdrawal from work or social activities. Again, when you think of all these other things put together that they may be experiencing, sometimes they just kind of clam up because they know that they're struggling, especially early on. They know they're struggling with trying to connect with people. And if the people around them don't know, they're not going to make any efforts or special changes, right, to how they communicate. So it might be just easier for them to kind of step back. And now I will say that I'm on the other side of the age hill when you look at average human lifespan. So I feel like I definitely have changed as far as my social activities. COVID has been kind of a blessing for introverts like me, where it's like, no need to see people. But again, if that wasn't your thing, if you were sociable and whatever, and then now you're not, that's where, you start to have some concern. And the last one there is number 10, changes in mood and personality. And I think this is one that is probably the almost like the exclamation point when families and friends start to notice that that is not my friend, that is not my mom, that is not how my dad talks. That's often when they realize, okay, all this other stuff might be other things, but now there's something that I feel that's not my parent or my loved one. Yeah. So these, in a nutshell, are the 10. Now, feel free to throw questions in the chat. I'm going to move on to a little bit about early detection and what that's like and why we do that. So early detection is important basically because, I think like any other health condition, right, you want to catch it as early as possible. So your intervention, your choices of interventions and treatments and resources can be really taken advantage of, right? I mean, you think about people, one of the things that I think was mentioned in my bio was advanced healthcare planning. If you do it on your deathbed in the ER, that's not a really good time to be, quote, planning, right, for your advanced care because your advance is very short, right, versus thinking about it a lot earlier on. Again, just like other healthy things that we do, right, we eat better, we exercise. A lot of times it's very easy to see how we do that for our heart, for our, our blood pressure, whatever. Same for your brain, right? The more that you know about your condition, the better, you can hopefully plan for your future. Especially right now with Alzheimer's disease having no cure, right? So we already know that if you are diagnosed with that, the trajectory is pretty standard, where you will decrease. And after you start seeing these signs, I think one of the doctors earlier said, you eventually lose your body functions, right? So let's talk a little bit about what happens next when you start to see these signs.
It's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, if they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
And that's where a lot of times families will contact us because they've tried everything, they've recognized the signs, oh my gosh, my mom is in denial, which, I mean, when you consider what's happening, right? Yeah, most people will not be, I've never really had somebody jump up and say, I have Alzheimer's disease, unless it's caught very, very early on, okay? So what I'm gonna do is, we have a really quick path that we made here, 10 steps to approach memory concerns. I'm going to go really quickly because this is actually on the handout, one of the handouts that I had sent out. But just to give you an idea of some of the steps you can take, one, of course, oops, that was a really fast path there. Okay, so of course, we're going to look at what do you see, right? Just kind of looking at those 10 warning signs, which ones do you see? Now, somebody might have 1, 2, 3, all. It's not a perfect recipe, but if you start to see them, I mean, that's the first thing we got to do, right? Is there anything else going on? There are so many things that could cause these medications, other conditions. One popular one, when people's blood sugar skyrockets, they sometimes, get confused, and sometimes families translate that as, oh, here he is, dementia, she's here. Not always, right? Or new medications, or change in medications, or even environmental things like stress can cause somebody to look like they are experiencing some of these warning signs. So just be cognizant of that. Learning about the signs and benefits of diagnosis, that plug is in there, not just for somebody who has these challenges, but for the family, the friends, and even anybody else who really wants to be involved in this person's life. And that's where it leads to find other people who may have noticed these changes. A lot of times what happens is you have somebody who has known this person all their life, and that's really the person who can speak to that change, right? I work with caregivers who maybe they moved away when they were young, and now their parent is aged and they are, quote, experiencing it, but it's so different being afar, right, versus seeing them every single day. So a lot of times we count on people who are very close to the individual to kind of give us a little bit of feedback on these changes. Now, this is the next step, having a conversation. Really important to think about who it should come from. Again, a lot of what happens with somebody with Alzheimer's or dementia, you got to pick your battles, right? So a lot of times I will say it is not the family member or their caregiver or their spouse or their kid that will be the correct person. I mean, if it is, great, but a lot of times they need that third party to serve as the quote bad guy, end quote. I don't use that term, but they want somebody else. And that, if that's the way to do it, then perfect, right? If it's the doctor, if it's me, or somebody else that has to kind of start this discussion, just think about who should be the one that does it or is a part of it. Think about time and place. I literally had a family tell me once, well, this is great. You know, I feel like we're so supported, and I think mom's going to be she's going to feel so much better when we talk about it. We're going to have a potluck and invite the family and tell her about her diagnosis. I'm like, well, that's interesting. Generally, I don't think that works, but if that works, I mean, again, if you feel that'll be the best way for them to learn about this, go for it. I mean, I guess you have, what is that? What are they called now? Where you pop the balloon and find out what sex your kid is? I mean, I guess you could do it for, I don't know. But that family literally thought, this is the best way for mom to learn about this because I feel like she doesn't want it to be a negative. Okay, whatever. So again, just think about where, when, who should be involved. Practice what you have to say. You know, if you need some coaching tips, we have them, or I can coach you on that, or our team can coach you on that, because that can be the hardest part, just telling them, I've noticed these changes. So-and-so has noticed them as well. Have you noticed them? You know, and depending on how the conversation goes, you might have to have more than one conversation. But the goal here is really to get them to see a doctor to start the clinical piece of everything, right? Just really checking on what are the other factors that could be causing these changes and so forth, and offer to go with them. A lot of times people don't want this to be something shared because it's tricky, right? I mean, they don't want to hear the news themselves, so why would they want others to be involved? But I think, you know, just offering support, whether it's doctor or whoever else they're going to go see along the way, always nice to do that. And again, like I said, be ready to talk about it many times. All right, and then of course, ending up with support from us, the Alzheimer's Association. So what I'm going to do is switch over to a quick, one more slide. This one is also in one of the handouts I gave you. These are, you know, a lot of times we encourage families to start with the primary care physician, your PCP, or whoever you see, and they will be able to connect to any specialist that they might need. For example, if you have a PCP who is not trained in Alzheimer's or dementia at all, they may not be the best person, to keep going as far as testing. So they will make that recommendation as to who. Depending on where you are in the state, you know, you have access to different things. Hawaii Island, very, very minimal in terms of neuropsychologists and neurologists. So, you know, it's a little different here. But in general, you know, it becomes almost a team effort when somebody is trying to go through this, not just from the medical side, but also social services side, when that, you know, becomes a part of the picture, and of course the family and their, you know, social group, social circle as well. So that's on a handout. I'm going to switch slides really quickly and just talk a little bit about our resources really quickly, and then we can, if you guys have questions, we can go through them really quickly. But let me switch over. Okay. So this is our logo. If you've seen it around and don't know what it is, this is what it is. It represents what is this called? The thing that scientists mix their magic potions in. I forget what it's called. What is it called? Does anybody know? Anyway, the flask. So there's that, and the other side is the person, the people, right? So people in science. I want to share a couple of things. In Hawaii, there is an estimated 100,000 individuals 65 and older living with some form of Alzheimer's or dementia. Another interesting number, about 51,000 caregivers, meaning family and friends, not paid kind, are providing care for these individuals. So I don't know if you're interested, but one of the things I'll do is at the end, I will put a link for a Google form if you would like more information, or you'd like to have us contact you for whatever reason, or if you want to ask questions, you can definitely do it there. But yes, 51,000 caregivers are estimated providing over $1.6 billion of care just in Hawaii alone. So if you put a price tag on this care, yikes, right? So just to give you some numbers, not to scare you, but of course, again, when you look at other diseases that are kind of tracking along the later lifespan, again, wherever you cut off later is up to you. But, with all of the advances in treatments for heart disease or even, diabetes and those things, you're starting to see deaths from those go down, whereas Alzheimer's disease, of course, the population is aging. But in general, because there's no cure, people die from it, right? And a lot of times it's hard to pinpoint that. When I worked at the hospice, it's hard because Alzheimer's disease itself is not, it might not look like that's the cause of death. If they stop breathing, well, then they stop breathing. And sometimes people don't draw that back to the fact that their brain is shutting down, right, because of the Alzheimer's. So it's a little bit tricky, but in general, main thing to remember is there's no cure right now. All right, so I'm going to cover the enhancing care and support piece because these are the services that we offer to the community. Information and referral, we'll go through these. Information and referral, really basic one, where you have, you just call in and ask questions, and we link you to information. We're going to hear from Caroline Cotterell in a bit about the Adrc. It's basically a similar piece of that, but specific to Alzheimer's and dementia. Again, you can call us and ask whatever you like about information that you need or about the disease process or support that you need. If it's more in depth, it becomes what we call a care consultation. At this point, we're talking about a lot more in-depth things like how to figure out nursing home placement or even if it's a little bit more about the legal planning. I get a lot of that question, right? How do I prepare myself or my loved one if we now have this diagnosis? What do I have to do? Education and training programs, we often, oh gosh, there's my picture. But we have programs just like this one. Of course, they're generally an hour long, but we have an ongoing schedule. We like to partner with organizations and providers, like you see Dr. Fujikami there, to present these types of topics. But if you're interested, again, use the link that I'm going to share with you later to really just tell me what you're interested in and what you'd like to learn more about. So here's some examples. Today we actually did a modified version of that first one there, but a lot of these are offered regularly throughout the year. People think, okay, well, don't offer too much. Well, you know what? People learn about this stuff when they learn about this stuff. Every day somebody gets diagnosed. Every day somebody sees one of those 10 warning signs. So we're going to keep offering it regularly. And support groups, a lot of people don't like these, but once they jump in there, it's like, I wish I started earlier. And honestly, our support group is very informal. It's really a safe place for just caregivers to share. Share your best practices, share the things that work for you, the things that don't work for you. It's just really nice to see a very organic type of conversation versus, coming to a class and learning 10 things. So that is available right now from virtually, but in April, we're going to start going back out there and maybe doing a few here and there in the community for folks who don't, do the Zoom thing. It's not everybody's thing, right? So that is there. And the last thing, 24/7, we have a helpline that is answered by real people across the nation. I don't know exactly where all of them are, but it is 24/7. The cool thing about this is that all of those services, the services of information and referral or care consultations, they can provide that. There are master's level staff on this helpline. So even if you need a little bit of that, I think I'm done with this. I don't know what to do. It's 3 a.m. and I've been, trying to caregive for my mom for the last 10 hours. Help me. They can handle that kind of thing too. Okay. So that is my content. I'm going to stop sharing. And, one of the things I want to say is we work very closely with the Aging and Disability Resource Centers across the state. And we're going to hear from Caroline in a little bit. And, it's really, when I think about Alzheimer's disease, supporting somebody with that condition or similar condition and their families, it's really important to have a community network that really understands all of this. Because whether you are a social worker, a case manager, a primary care physician, or a CNA that's helping an elderly in the home, just understanding what dementia and Alzheimer's looks like is what it can be. It really helps provide better care. And, one of the key things for the Adrc is really, just like how I said, information and referral and really figuring out what your needs are. I think that's one of the biggest things that all of us do across healthcare social services is just tell me your story. I mean, it's a little different, I think, from maybe former years. I mean, even when I came into the field, there were a lot of checking off boxes, right? And it's like, okay, but what did they tell you, right? What are they feeling? Are you capturing that? So that's where the ADRC, I think, I won't talk too much about it, but I did work there, by the way. It's such a beautiful project because it really gives people a voice behind, aside from all the check boxes and diagnoses. When you think about all the things we talked about, you can get diagnosed and have all your plans in place, right? All your legal stuff, all your healthcare stuff. But guess what? That emotional, psychosocial stuff is still going to be there when you go home, right? And that's where I'm happy to have my my friend Caroline Cadirao from the Executive Office on Aging talk about the Aging and Disability Resource Center. So thanks again, and we'll have questions and answers at the end, I believe. So Caroline, I guess I'll turn it over to you. Thank you.
Thank you, Nick, and thanks to Charlene and Desmond for getting us up and going and for the nice introduction earlier. Thank you so much. I'm Caroline Cadirao, Director of the Executive Office on Aging, and I'm here to share with you today resources that are available for you in your community. And what are those resources? How can you prepare? Nick talked about that. You don't want to wait till the end or till you're in some type of crisis to prepare for your future. So we're going to discuss some of that today. And I'm going to go ahead and share my screen now. Okay, are you guys seeing the full screen?
Yep, we're seeing the full screen.
Okay, thanks. Okay, so I do apologize. I took right off of the intro to this thing and I did the whole title. So no, I'm not presenting dementia. Thank you, Nick. You did a great job. But I will be presenting on the resources and information. And today I'm going to touch on who is the Aging Network. So I want to take a step back before we get into the resources so you understand what our network does and how this all intertwines. Who do we help? What do we do? What do we provide in the community? Where to go for information and resources? And I just want to kind of wrap up the current landscape during this pandemic, and I'll end with that. So the mission for the Executive Office on Aging is to optimize the health, safety, and independence of Hawaii's older adults and people with disabilities. And we support both our kupuna and their caregivers through planning, development, advocacy, and coordination of policies, programs, and services. And today we're going to really touch on what are those programs and services and how do you get the help that you may need for your loved one or a family member. Maybe they're even living in a different county, and we'll discuss all of that today. So these are our values and principles, and it's really to ensure that kupuna in their golden years can really live with that independence and dignity and respect while maintaining good health. We are a program, an attached agency to Department of Health, so really we do the whole spectrum from the healthy older adult to individuals in residential settings, long-term care facilities. So we span the gamut. Today, we're going to be talking about our home and community-based services. So this is the Aging Network. And the reason I touch on this is so that you just have an understanding of where in your community you can reach out for support. So the Executive Office on Aging oversees all of the programs, services, and supports at a state level. We have a policy advisory board on elder affairs, which Charlene's been part of and is still part of our legislative committee. We receive funding from both the Administration for Community Living and the state legislature. So we have both federal and state funding and laws that we follow for both. And then we, in turn, contract out and with what we call our local area agencies on aging. And that's where Nick and I crossed paths because he used to be at the Hawaii Area Agency on Aging, which operates the Aging and Disability Resource Centers that we're going to be talking about in a little while. So each county is a designated area agency on aging. So if you're in Maui County, there's a Maui County Office on Aging, and that's where you would go to find services and supports within Maui County and respectively in each of the counties. They in turn contract out services and supports with providers in the community who in turn are the ones, there are boots on the ground. They are the ones out there providing the array of services and supports in the home and in the community. And I can't speak enough about the importance of course, partnerships and stakeholders. We really rely a lot on that also. So who do we help? We provide information and assistance to anyone that calls or reaches out to us in the various forms that we have. If a caller is an older adult or a caregiver and they are expressing they have a need or they don't know what to do, you know, we will ask them, do you have time now to talk to us? And we will conduct an assessment of what their needs may be, or we'll go ahead and schedule time with them later and we'll get some basic information. And then after we've done an assessment, we look at how can we support them with publicly funded supports, and those are the services we're going to be talking about. Do they have natural supports? How does that help and play into their situation? And we also look at, do they have, we don't do a fiscal assessment type of thing, but we also look at, could they possibly look at paying for supports if they needed additional supports beyond what we have to offer. So we do what we call options counseling, looking at all their options and really doing a holistic assessment of both the older adult and if there's a caregiver involved with their caregiver. So these are just an array of the services that are provided throughout our state. Again, these are to really help individuals to remain independent at home for as long as possible with the supports that are provided. So if you're in need of transportation or someone to come in and provide homemaking or chore services, we have our legal services developer and the programs out in the community that provides for those things. We provide congregate dining, caregiver support, case management, personal care, adult daycare and adult daycare settings. And we also have a self-directed program that we provide. It's limited in scope, but it's something that we're growing, especially during this time of COVID, where people are also looking at possibly hiring family and friends to help them with their activities of daily living. So Nick touched on it, and that's where I wanted to share with you our Aging and Disability Resource Center. And when I was talking about who do we help and how do we help them, this is how we do it. We do it through our Aging and Disability Resource Center. And again, that's that process of helping individuals assess their needs and doing it in a person-centered way and a holistic way. And again, developing that individual plan of how we're going to support that person to remain independent for as long as possible. And that's what people want. Most people want to stay either in their homes with their families as long as possible. So we do that through the Aging and Disability Resource Center. And information, and that's what I really wanted to touch on today, is provided obviously in many forms. You can pick up the phone, you can call the Aging and Disability Resource Center. We can mail you hard copies of resources, and there's different resources in each of the counties. And also we have our Aging and Disability Resource Center, our online Adrc, the website, where you can search for services and supports on your own and read about things that may be of interest to you as you're planning out for the future or planning for a loved one that you may be caring for. And those resources is this number here. Again, remember, dial 808 first, 643 ADRC, and that's 2372. that will connect you with your local ADRC. So like the Pizza Hut, where you can call that number, the 643, I forget what the number is, but you call the number and it goes to the closest one to you. If you're calling from, say, Kauai, it will contact the Kauai office. If you're calling from Hawaii County and you're in Hilo, it'll route to the Hilo office. Here on Oahu, it routes to the Honolulu office, and same with Maui. And then if you are calling or you have family that's calling in from the mainland, it will get routed to our Honolulu office, and they will go ahead and make sure that it gets routed to the appropriate place where the loved one may be living. And then our website is hawaiiadrc.org. And I'm going to go ahead and show you a screenshot of that so you have an idea. This is our landing page for the ADRC. We've recently updated it, but there's still some tweaks we're doing with it. But we have information about the ADRC. There's reports and publications that we have up there. And one thing that I do want to share with you, and I'm not sure if it's going to come up, I can't click on this to show you, but we do have a memory care roadmap that we had developed a few years back under one of our Alzheimer's grants that we had. And it's a memory care roadmap for family caregivers, and that you can find under reports and publications at this website. And then contact us. This is important. This is where if you're wanting specific county information, click on contact us and it will take you to this page. And this one, you can either log on to the different websites of the different counties, or you can click on each island and it will take you directly to their website. And I know, Nick, I don't want to put you on the spot. I think you said you were going to put some of the links inside the chat.
Yeah, and I think actually Desmond posted the entire list. So there's an attachment in there. So yeah, they're there.
Thank you, Desmond. But this is where the full, let's see, I'm going to show you the next page. You'll see all the county information for each county. So Hawaii County, Honolulu, and this is all on that contact us landing page, and Kauai and Maui County. So you can either, like I said, click on each of the islands, or you can just click right into their specific websites when looking for information. But the last thing I wanted to talk about again before I close out, and I really want to express, is that it's been a really hard 2 years for the Aging Network. So much of what we've done and what we provide in the community has been either impacted by COVID. Congregate meals basically shut down during this time, but we pivoted. How do we pivot and support our community during a pandemic? So we were able, the federal government allowed us to loosen up our restriction, our qualifications for home delivered meals, because a lot of people, because of COVID, now were isolated at home. So we received a lot of CARES Act monies, ARPA monies from the federal government to support people where they were at. So we really ramped up. We increased meal delivery in the last year by almost 85% from the year before. So taking the meals to the people so that they could remain safe at home, and specifically before the actual vaccine came out. You know, so many people wanted to stay put, and really it was a health and safety issue. And you know, we thank the federal government for providing us with the funds so we could really increase and meet the demand and the needs in the community. Again, very important to plan ahead. You know, a lot of times people do wait till the end. We had a call here maybe about 4 weeks ago, and it was a Tuesday, and she said, my mom has to be out of her home. She lost her home. She had been scammed. She's losing her home. She has nowhere to go, and she needs to be out by Friday. And I felt bad. I had to do a reality check. I said, you may want to look at, well, first I counseled her about maybe she could take her mom in, but we're not going to get into that. But, and there were issues around that. But, looking at maybe temporary sheltering for her or something like that, because I said, we have 3 days left. And, I linked her up with our local Honolulu ADRC, and we worked together with her to help her. But at that point, it really was hard because now they're in crisis, right? So we do really try to encourage people, plan ahead, have a plan of action. Part of what the ADRC does too is we do disaster preparedness, and we look at, well, what's going to happen if there's a hurricane or if there's different natural disasters. And that's always been our focus. And Nick can remember that. Now we're taking it a step further. What do you do in something that's long-term like this, a pandemic? How do you prepare for that? And what do you need to have in place? And so we've gotten federal funds through and provided to all our ADRCs to really provide toolkits and support people at their homes, where they're at, so that they can really plan for their stay while they're in this pandemic. And that's something that I'm really proud of Hawaii County. They really had some toolkits. They had a little video thing that people could watch and really prepare during the pandemic in the early stages. And I think that was really helpful. And again, that's when masks were very limited, PPEs, everything. So we were able to secure some of that and provide that in the kits that we provided. So I know I was here to talk about resources, and my whole life for the last 2 years has been around this pandemic, but it's something that I wanted to share with you so that you understand how our network pivots and addresses some of the needs in the community. But again, we did lose a lot of providers because of the pandemic, and we're working again to build up our workforce at the provider level so that we can really continue to meet the needs of older adults in our community. But I think I want to allow time for questions. And I know there may be a lot for Nick too. His presentation was spot on. It's my life as I'm living it now. My dad has dementia and he lives with us. And my mom's been very stressed. So Nick, your presentation it hits home every time I hear it. But I think I'll go ahead and hand it over back to, I guess, Nick, and to anyone that may have questions. Thank you.
Okay. All right. If anyone has questions in the room, do please put it in the chat box, and then please indicate on whether it is for either Caroline, Nick, or both. Thank you.
And really quickly, I did put a Google form a link in the chat there. If you folks want to stay in contact with us or be on our email list, there's a couple of questions you can answer there. I'd love to hear, what your questions are. I know that from a legal perspective, it is, it's very tricky to work with individuals who may be experiencing dementia, Alzheimer's, or just cognitive challenges. So we're here to work with you on that as well. So feel free to click on that link that I put in there and share any questions you might have and your contact information, and we can connect with you.
All right. Looks like we have a question from Jonathan, and this is for Nick. Do you have a schedule for the other presentations that you listed?
Yes. What we're doing right now is what I can do, if it's okay, I'll drop it in the chat. We have a flyer that goes out. I'm putting March's flyer in the chat there. You can take a look at that. And also what I'm going to put in there is a list of our current support groups. Our support groups are scheduled pretty regularly. So as they are broken by physical location, because the intent is to keep you in your community when we go back out there. But really virtually, it kind of doesn't matter, but that's the one reason why it's still split up that way. Because the people, like, for example, I run the ones for Hawaii Island caregivers because I'm very familiar with what's happening here as far as resources, programs, and so forth. So that's the main reason why we still keep them separate. But I put those two attachments in the chat. Hope you can get them. If not, I can send them to you folks after.
Okay, and looks like we have I don't think this is a question, but this is from John. It says, I would have like a discussion of the contrast between Alzheimer's and the normal effects of aging, please.
Okay. Yeah, and generally that in itself is an hour presentation that we do have. You know, in a nutshell, though, of course, Alzheimer's is, again, the most prevalent of the types of dementias, but there are many other types. Some of them are very rare. I mean, I've met some people with these that I've never heard of in my life, and I have to go through our thing and research what the whole pathology and everything is so I can help them. But yeah, it is generally the most common. Again, 80 to 90% is Alzheimer's. But if you'd like something after, I'd be happy to set something up.
Okay, and looks like there is
sorry about that.
A message
I
from
see that.
Lisa. Okay.
Okay, got it. Let me fix that and I'll put the link back in there.
All right. Are there any other questions from our participants here today? If not, I am going to turn it over to Gil to give his closing remarks. Oh, sorry. I think we got another question from Jonathan. This is for both. Are there treatments or exercises or tasks that can slow down or help the symptoms?
Both. Okay. I can answer from the Alzheimer's disease side and dementia. Yes, they're looking a lot at right now lifestyle things. Actually, that's what they're looking at, right? I think a lot of focus is pharmaceutical and medical treatment, but they're looking at how lifestyle can really affect somebody's outcome as far as brain health and reducing that risk for Alzheimer's. The number one risk factor for Alzheimer's that none of us will escape is age. So the older you are, yeah, I know that I saw some faces. The older you are, I mean, it's like any other part of your body, right? You start to lose a little bit of skin elasticity and color in your hair and whatever. Same with your brain cells. But they are looking at the different types of things: diet, exercise, social. If you're familiar with the Blue Zones Project, a lot of that actually translates to brain health and staying as healthy as you can brain-wise as the older you get. 85 years old is kind of one of the key timelines in somebody's age where you see a little bit of a big uptick in terms of the risk for having Alzheimer's or dementia. So 85, if you make it there, anything past that is extra credit. Go to Vegas, do whatever. My great grandma lived to her 90s, and one of the last things she wanted to do, which we did not do, was go see the Great Barrier Reef or something. But my tip is, if you make it to that age, then do whatever and just enjoy it, right? And let your family caregivers deal with it. That's why you go see your attorneys, to make sure your plans are in place, right? So that you can just enjoy and not worry. But yeah, a lot of lifestyle factors, really cool stuff. One of the things I will, maybe if I can do a follow-up email with you, Desmond, there is a Science Hub app that you can look at all of the different research projects that the clinical trials and studies that are happening for Alzheimer's and dementia. Because, I mean, I'll give you an example. There's a cool one that they did in the UK on mothers and how they saw there's a possible link between how many kids you have and your risk for Alzheimer's. Yeah, I know, right? And there's actually a number that they started to identify. If you have 3 or more kids, your risk actually is they're looking at this possibility. Your risk goes down. And so the hypotheses are things like, well, maybe because their brain's going to high gear when you have that many kids, that you're actually exercising. You know, there's so many things, but the fact that they found something, it's like, holy cow, go have kids, everybody, right? So, I mean, but going back to the question, yeah, a lot of it is just lifestyle changes that they are looking at. Yeah. Yeah, I mean, for me, it's, I don't think that would work for me anyway. I can't have them. So. Caroline, I don't know if you have anything else regarding aging in general. I don't think we can get away from that one, but
yeah, that one, I just say age well, take care of yourself. Like you said, Nick, diet, exercise, all the things. I mean, we all know it. we may preach it, but really, it's lifestyle.
Yeah.
Okay, I think we can take a final question. This is from Charlene. What can legal aid services provide through ADRC?
So I'll go ahead and tackle that one. The Aging and Disability Resource Center, the legal aid services, I think are all part of our resources that are at our website. And also some of the legal aid, Lash, I believe, is it Lash? Is one of the providers of the legal services that we provide through our Older American Act programs. So I would say start with, if people are looking for help with either their planning, advanced care directive, things like that, they can reach out to the ADRC, and they can, the ADRC can help them make those links with those different programs in each of the communities. In each of the, well, ours are by county, right? So in each of the counties.
All right. If our speakers and our participants are okay, I'll just hand over the mic to Gilbert Dose for the closing remarks.
Thank you very much, Desmond. Thank you very much, Caroline Caderal and Nick Los Baños. We really appreciate what you both presented to us, and I'm sure that we will all the information is very useful to all of us. So thank you very much, and everyone have a nice afternoon. We'll see you at the next program. Our coffee hour next month will be on April 7th, and will feature Dr. Heather Sanderson, the daughter of one of our board members. Okay, with that, we'll say goodbye to everyone until we meet again. Aloha.
Thank you.
Thank you, everybody. Aloha.
Aloha.